Assalamu alaikum to students. Today we will talk about how to develop integrated curriculum. So in this lecture, we will discuss about the different steps required for the development of integrated curriculum um, in the health sciences. So first of all, what is integration? Integration is the organization of teaching matter to interrelate or unify subjects frequently taught in separate academic courses or departments. Integrated curriculum is also referred to as interdisciplinary teaching, thematic teaching, or we can also call it as the synergistic teaching. An integrated medical curriculum helps graduates to put together the learned facts so as to get the whole picture and adopt a holistic approach while treating a patient or planning a health care strategy. Simple words में we can say that कि integrated curriculum ऐसा है कि जिसमें हम मुख्तलिफ डिसिप्लिन को कंबाइन करके एक मॉड्यूल बना लेते हैं। उसको मॉड्यूलर सिस्टम भी कहा जाता है और आजकल जो जितनी भी मेडिकल कॉलेजेस हैं मोस्टली दे आर यूजिंग दिस इंटीग्रेटेड कुरिकुलम। मिसाल के तौर पर आप मस्कुलोस्केलेटल सिस्टम ले लें, सो दिस इज ए मॉड्यूल। तो स्टूडेंट्स जो है इंटीग्रेटेड कुरिकुलम में एनाटमी जो है पढ़ने के बजाय जो क्या करेंगे, एक मॉड्यूल की एनाटमी, उसकी फिजियोलॉजी, उसकी बायोकेमिस्ट्री, उसकी फार्माकोलॉजी, उसकी पैथोलॉजीज, ये सब के सब एक ही साथ पढ़ेंगे आप इस सिंगल मॉड्यूल। सपोज जीआईटी, दिस इज अनदर मॉड्यूल, तो उसकी एनाटमी क्या है, उसकी फिजियोलॉजी क्या है, बायोकेमिस्ट्री क्या है, फार्माकोलॉजी क्या है, ये अलग पढ़ेंगे। So, यहाँ पर इंटरलिंक डिफरेंट सब्जेक्ट जो डिसिप्लिन है वो आएंगे। इससे जो नॉन इंटीग्रेटेड कुरिकुलम में पहले ये होता था ना कि सब्जेक्ट्स पहले एनाटमी होता था, एनाटमी में जीआईटी की एनाटमी पढ़ी जाती थी, रेस्पिरेटरी एनाटमी पढ़ी जाती थी, नर्वस सिस्टम की एनाटमी पढ़ी जाती थी, जितने भी मसल्स है इन सब की एनाटमी पढ़ी जाती थी और इनका एक सब्जेक्ट होता था। इसी तरह बायोकेमिस्ट्री की अलग होती थी, एंड देयर वाज नो लिंक बिटवीन दीज disciplines and these subjects. But in the integrated curriculum, they all have been linked, and that's why they can also referred as interdisciplinary teaching or synergistic teaching. Synergistic teaching भी ये है कि एक ही मॉड्यूल को जो है आप उसमें जितनी भी उससे लिंक्ड है, फार्माकोलॉजिकल एस्पेक्ट्स है, एनाटॉमिकल एस्पेक्ट्स है, उसकी फंक्शंस है, उसके बायोकेमिस्ट्री लेवल पर कुछ उसकी रिलेवेंट डिस्कशन है, या उसकी सम पैथोलॉजीज है रिलेवेंट टू दैट मॉड्यूल, वो सब के सब एक ही जगह पे जो है टीच किया जाता है। और ये इनकी जो सब्जेक्ट वाइज की बजाय मॉड्यूलर सिस्टम होते हैं, पेपर भी इनकी, सपोज दिस इज एमएसके पेपर, दिस इज जीआईटी पेपर, तो उसके पेपर में फिर जो एग्जामिनेशन पेपर की बात कर रहा हूँ, वहां पर भी जब इनकी असेसमेंट होगी तो उसमें पैथोलॉजीज भी होंगे, एनाटॉमी भी होगी, फिजियोलॉजी भी होगी। तो ये इसको हम इंटीग्रेटेड कुरिकुलम कहते हैं। An integrated curriculum that help graduate to put together the learned facts so as to get the whole picture and adopt a holistic approach. और ये जो अभी हम डिस्कस कर रहे थे कि that is that holistic approach, which is we can say that the modular system. In integrated teaching programs, the timetable is adjusted so that the related topics within the discipline are scheduled at the same time. और इसमें इसको स्मार्ट टाइम टेबल भी कहा जाता है, और जिसमें इस तरह की एडजस्टमेंट की जाती हैं कि जो टॉपिक विच आर लिंक्ड विद ईच अदर, दे ऑल आर discussed, they are taught at the same time. Similar topic, for example, structure of the kidney and anatomy and function of the kidney and physiology are taught on the same day, on the same week, uh, ताकि स्टूडेंट जो है उनको एक दूसरे से इनका लिंक हो। एक डेफिशिएंसी हमारी एक जो कुरिकुलम है उसमें ये थी, मिसाल में डीपीटी के कुरिकुलम लूंगा जो डॉक्टर फिजिकल थेरेपी में है। वहां पर स्टूडेंट जो है थर्ड सेमेस्टर में एनाटॉमी पढ़ते हैं, हेड एंड नेक जो है एंड स्पाइनल कार्ड, इसकी एनाटॉमी पढ़ते हैं, लेकिन इसकी जो फिजियोलॉजी है वो दूसरे सेमेस्टर में पढ़ते हैं। यानी जो इसकी फिजियोलॉजी एनाटॉमी है या न्यूरोफिजियोलॉजी है, ये अलग-अलग सेमेस्टर में पढ़ाया जाता है। सिमिलरली आगे जाके फिर हमारे एक सेमेस्टर में इस तरह होता है कि उसकी ट्रीटमेंट जो है ये पहले पढ़ाया जाता है, जबकि पैथोलॉजीज़ जो है बाद में पढ़ाए जाती हैं। यानी जो मैनुअल थेरेपी है वो 6th सेमेस्टर में है एंड एमएसके जो पैथोलॉजीज़ है, डिसऑर्डर्स एमएसके वो 7th सेमेस्टर में। तो वहाँ पर भी एक डिफिशिएंसी ये आती है। तो ये लिंक नहीं है, तो वजह क्या है कि स्टूडेंट्स जो हैं अगर पहले सेमेस्टर में उन्होंने एनाटॉमी पढ़ी है और अब वो फिजियोलॉजी की तरफ आ रहे हैं, या उन्होंने पहले फिजियोलॉजी पढ़ी, अब वो हेड एंड नेक एनाटॉमी पढ़ रहे हैं, तो लिंक नहीं बनेगा और वो क्या करेंगे, उस प्रीवियस सब्जेक्ट को दोबारा से रिवाइज करना पड़ेगा। इसलिए नाउ दिस इज द डिमांड ऑफ द डे कि इंटीग्रेटेड कुरिकुलम, उसकी बहुत एडवांटेजेस हैं। तो सिमिलर टॉपिक लाइक किडनी की जो स्ट्रक्चर है, किडनी की जो फिजियोलॉजी है, वहाँ पर बायोकेमिस्ट्री जो जो जितने भी बायोकेमिकल प्रोसेस हैं एंड एज वेल एज उसकी जो रिलेवेंट पैथोलॉजीज हैं, दे ऑल शुड बी डिस्कस एट द सेम टाइम, ताकि इन सारे के सारी जो discipline of the relevant to the kidney ye interconnected हो, but still remain part of a subject-based teaching and students are left to themselves to uncover the relationship. So subject-based teaching वही है जो अभी हम discuss कर रहे थे. If it is a subject-based teaching, still there may be integration of the different similar topic. Problem-based learning is very useful way of integrating learning. The vertical integration between basic sciences and clinical medicine in a PBL setting has been found to stimulate deep rather than superficial learning and thereby stimulate better understanding of the important biomedical principles. The integrated teaching does not necessarily require the adoption of a problem-based approach to learning, and many effective integrated programs they are not problem-based. The integration can be organized around themes and PBL, case-based learning, and the traditional curriculum. Now, what are the different steps while developing an integrated curriculum? So, 12 common there are basic steps which can be used to integrate the existing curriculum or for the develop new curriculum, which we call as the interdisciplinary curriculum or the integrated curriculum. So these 12 steps are train the staff. सबसे पहली बात ये कि उनको जो स्टाफ इनको पढ़ाएंगे उनको इंटीग्रेटेड करिकुलम के बारे में उनको थोड़ा सा गाइड करना है, तो उनकी ट्रेनिंग करनी है। आगे हम डिस्कस करेंगे हाउ they can be trained, decide on scope of integration, choose the level of integration, go for both vertical and horizontal integration, establish working groups and elucidate their responsibilities, determine the learning outcomes, identify the contents, which mean the three domains, the psychomotor domain, the cognitive domain, and the affective domain, the knowledge, skills, and attitude, creation of the themes, the construction of a timetable, assessment strategies, communication between the faculty and the student, and to reevaluation and revision of this integrated curriculum. And there should be a proper pathway for the reevaluation and the revision and updating of this integrated curriculum. So first of all, we will discuss the training of the staff. Integration of the curriculum entails a lot of time and work in respect of planning, organization, and execution, and that's why there should be proper training of the staff just to avoid any inconveniences. The teachers have to be deeply involved. They should have to be very enthusiastic, as well as they should be very cooperative, especially with the departmental borders. Beyond the department, but they should be believe in teamwork. They should work with each other, and this will provide a positive spin-off effects in teaching and research, but may also generate conflicts that must be resolved through mutual agreements. Some form of staff development will also certainly be needed. The aim of this training of the staff, there should be to familiarize the staff with the objectives of an integrated program and allow them to explore its advantages. The aim should be also to identify the local barriers to increase integration as an initial step and address them effectively, as well as the aim should be also to explain the staff members how the integrated teaching learning program will be delivered and their roles and responsibilities in it. The second step is to decide on the scope of integration. It may be an ideal to change to a new integrated curriculum. There may be a lot of challenges. There may be a lot of hurdles because you are working. The teachers they are used to work and to teach in a way in a method for years and years, and you are going to change them suddenly. So it will be a very big challenge for them to incorporate themselves in the new methodology. So that's why it is not impossible. It's possible, but it's too challenging. So that's why to start with, the scope of integration may be limited to only a module or a phrase, and not completely program should be integrated, as it will be too difficult for the staff, for the faculty member to cope with that sudden new change as a whole. So in the start, there may be few several modules which should be taught as under the principles of the integrated curriculum, and this will help to the teachers to adopt with the new approach to the new strategy, that is the integrated curriculum, gradually, and would be less stressful if they are adopting gradually, and this will provide an opportunity to learn from the experience, and each year, each try, through each try there will be more and more experience, and hence when at a time the whole program is changed and shift to the new approach, the integrated curriculum, they will be already familiar and used to the this new integrated curriculum approach. The third step is choose the level of integration. What is the level of integration? So in 1991, a paper was published by the Fogarty, and that described the 10 levels of curriculum integration. And hope we will discuss this level of that in curriculum integration in some other lecture as well. Then in 2000, the Harden they presented a ladder with 11 steps in the level of integration from isolation to the transdisciplinary level. We will also discuss those ladder of the integration, which is simply known as the integration ladder. A number of factors such as the aims of the curriculum, organization structure, staff and resources, and assessment methods need to be considered before deciding the level of integration. The level of integration may vary from module to module, or even within a module, there may be a variation among the levels. Many educationists feel that there is a need for both the subject-based and integrated experiences in the curriculum. We have discussed in the previous slides that what we mean from the subjects-based and integrated in curriculum. The next step is go for both the vertical and the horizontal integration. Integration may be described and maybe both as horizontal integration or the vertical integration, and that may be both of them should be incorporated in the development of integrated curriculum. The horizontal integration is integration between parallel disciplines such as anatomy, physiology, and biochemistry or medicine, surgery, and therapeutics traditionally taught in the same phase of the curriculum. As we discussed in the previous slide, that if there is a module of the renal system, so there should be anatomy of the kidney, physiology of the kidney, the biochemical process which occurring there in the kidney, the pathologies, as well as the pharmacological aspects and management of these pathologies are relevant to the kidney. That should be taught in a similar time, in a same week. So that is the horizontal integration. So this is actually known as the horizontal integration. While the vertical integration is the integration between disciplines traditionally taught in different phases of the curriculum, it can occur throughout the curriculum with the basic medical and clinical sciences beginning together in the early years of the curriculum, while they are also going to be continue until the later years. More emphasis may be placed on the basic medical sciences in the early years, and more emphasis is given on the clinical sciences and the practice of medicine in the later years. This approach is actually known as the vertical integration. Now, in integration, there may be the vertical integration, that may be the horizontal integration, or there may be both of them in the same approach and the same developmental of the that integrated curriculum. The vertical integration bring more relevance and excitement in learning. To involve clinician in preparation of basic medical sciences modules and vice versa is vital to develop vertical integration. Since both there will be clinical sciences as well as the basic sciences, so that will be a vertical integration. Sessions such as early clinical exposure and use of clinical examples in teaching session of basic medical sciences will generate interest among the learners, that will increase their enthusiasm and that will increase their excitement, uh, and obviously that will help them to see why it is important to learn the basic sciences. Inclusion of some introductory clinical topic in the basic medical sciences modules and vice versa would help to achieve higher level of vertical integration. For example, a session on dyspnea and the respiratory module and inviting surgeons to teach applied anatomy will help to accomplish the desired benefit of integration. Now, in this integration, there is the basic medical sciences as well as the clinical sciences, and between them, the integration, this is a vertical integration. The next step, the tip which is between to develop integrated curriculum, the tip would be establish working groups and elucidate their responsibilities. It is vital to set up different working groups and define their responsibilities. Each module should have its own module integration committee, which simply we can call as the MIC, which may be led by the module coordinator, the MC. The Faculty Integration Committee, FIC, should be led by a senior academician, preferably by one who will also hold a key post, such as the Deputy Dean Academics. The membership of the working team should depend upon the module to be integrated. For a pre-clerkship module, apart from the representatives of all the basic medical sciences disciplines, for example, anatomy, physiology, biochemistry, microbiology, parasitology, pathology, and pharmacology, the team should include a medical educationist and at least one relevant clinical teacher as a member. So that all will just make a team. For a clerkship module, the majority of the members would be clinicians with adequate representation of the relevant basic medical teachers. Each team should choose their secretary and scribe and specify their roles. FIC should comprise the senior faculty members. The representative from different relevant disciplines may be invited as and when required. The MICs would present their integrated modules to the FIC, where each module should be examined thoroughly and critically, emphasizing on the learning outcomes, both the cognitive learning outcomes, the psychomotor, as well as the affective domain. The content of that subject, the relationship of contents of the learning outcomes and the themes, sequences of topics, teaching learning methods for each topic, and specifically it should be differentiated for both the psychomotor domain and the outcome of the cognitive domain. content of each topic and their relation to the learning outcome, and as well as the assessment method. And separately, the assessment method should be separately described for the cognitive domain as well as for the psychomotor domain and the affective domain as well. But usually the affective and psychomotor domain they are assessed through same assessment strategy. The sixth step is the determine learning outcomes. Usually, if the teachers they have the table specifications, so they have already the outcomes in their hand, where they have these outcomes may be relevant to the cognitive domain, psycho domain, and the affective domain. So, if there is already pre-established and constructed TUC, the table of specification, then that's very good for them. But if there is no table of specification, there is no learning outcome. So for this tip is very important for the development of that integrated curriculum that should construct the learning outcome of that subject. So the learning outcomes should be short statements that are easy to communicate and usually begin with an action verb. They must be well developed as they not only specify what is to be achieved at the end of the module, but also guide the identification of the curriculum content, the teaching, learning methodologies, and assessment methods. So we have discussed them in the previous lectures. Each for the curriculum content, there is a specific column. Similarly, then there are three small columns in which we have to mention the which level this is the cognitive domain which level, this is which level of the psychomotor domain, and if it is the affective domain, so which level of it. So we have to identify not only the domain of this outcome or this content, but we have to also identify which level of domain it is. Suppose if it is the cognitive domain, so it is C1, C2, C3, and if it is the psychomotor domain, it is P1, P2, and so on. Similarly, at that table specification, we also have the assessment method as well at the end. That normally the system which we have, that if there is on the base of the knowledge, so they are assessed through MCQs, and those which are the practical skills are the effective skills, the effective domain, they are assessed through the OSP and OSCE. The learning outcomes of the module should be identified by the MIC, and then they should be approved by the faculty integration committee. The learning outcomes of each modules may be journal, which are broad statement and specific, which accurately and specifically identify the knowledge, skill, and attitude to be achieved in a particular module. So here we discussed two types of learning outcomes. One is the learning outcomes of that specific topic, yeah, we can say specific subject, and then general outcome of the whole module. So there should be general, while there should be also some outcomes, learning outcome of each sub theme, or we can say that the topic are that subject wise. For example, the ability of student to explain the mechanism of urine formation will be a general outcome, whereas their ability to draw and label a glomerulus would be a specific outcome. The tip 7 is identify the contents, knowledge, skills, and attitude. These are the three domains which we discussed previously. Each discipline need to map their curriculum content, the list down the topic to be covered. For example, the fluid in flight homeostasis, um, taking that same example of that renal system. Then the next that include the skills to be learned. Again, that is a psychometer domain, the practical. So, for example, measuring the specific gravity of the urine, and then the affective domain, which means the behavior, the feelings, the attitude of the students to be developed. For example, uh, appreciate the need of explaining to the patient how to collect midstream urine sample for culture or for examination. The content of each teaching, learning session or topic that need to be clearly written. There should be no ambiguity in that. There should be start. There should be concise, but not meaningless. There should be meaningful. For the enhancement of the integration between the basic and clinical sciences, the content should be created with the involvement of the relevant clinician. For example, the orthopedic surgeon can help in identifying the content for the musculoskeletal module. The content should be enough to keep the students engaged during the activity. Too many contents may overwhelm the students, and too few may not satisfy their curiosity. So there should be enough. There should be concise, but should be enough. There shouldn't be too few content, and there should be not overburden. There should be no overload of the information, as the overload of information as well as the underload of that information. They both may have the disadvantages for the student. The MAP curriculum should address all the learning outcomes. Some topic may be dropped, others added depending upon the learning outcomes. For example, if the outcomes include explanation of the jaundice in a newborn, the metabolism of the bilirubin need to be included in the curriculum, as the metabolism and bilirubin and the jaundice, they have a link between them, so that should be included. If the outcome said that the students should be able to measure the blood pressure, the surface anatomy of the arteries need to be included in the curriculum, as the arteries and the blood pressure, they are interlinked with each other. Blood pressure is measured of the arteries, so they are, because of their interlink, the anatomy, the anatomical structures and their detail about the anatomical aspects of the arteries, that should be included in the curriculum, which is going to discuss how to measure the blood pressure. The tip 8, create themes. Themes unite the discipline and blur the boundaries among them. The theme of the week act as a magnet for all the teaching learning activities during that week. And focusing on themes enables teachers to meaningfully link different disciplines so that students will see the big picture and appreciate the relevance. For example, the basic sciences learning to their future practice. Themes can vary in nature and scope. However, they should be motivating to students and relevant to the modules. In a modular case-based or traditional system, the theme can be identified for each week. For example, in the endocrine system module, diabetes mellitus can be a theme for 1 week. During this week, physiology and biochemistry may contribute to the insulin synthesis and its regulation, medicine to the clinical manifestation and investigation of the diabetes mellitus, pathology to the underlying disease process, and the pharmacology to the action of the hypoglycemic and related drugs. Themes related to the clinical problem, for example, dyspnea, should be preferred and not biological function mechanism of breathing. But during that theme terminology and theme nomenclature, they should be based on the clinical problems, but their biological function and mechanism that should be included later in their content. But the topic that should be their terminology and nomenclature should be based on the clinical problem rather than the biological functions. Tip 9. Prepare a comprehensive timetable. Choose the themes carefully, as they will also determine the sequence of teaching learning sessions. The theme for the first week should reflect the topics that need to be covered in the early part of the module. The flow of the topic should be logical. There should be a proper and logical sequence. And each new topic should build on the previous knowledge. There should be link and there should be internal consistency among the flow of the topic, among the sequence of the topic. For each topic, knowledge and skills, choose the most appropriate teaching learning method, such as didactic lecture, small group learning, or self-study. Some of the topic are best taught in joint session or symposia, not only to avoid overlap and duplication, but also for the integration. The learning and the teaching methods also need to be consistent with the learning outcomes. And so it means if it is the cognitive domain for one module that should be taught by one method. So the next module of that same level and the same domain, they should be taught with the similar and same methodology. It means there should be uniformity as well as consistency among the different strategies which will be used for the teaching of the different learning outcomes. If at the end of the module the student is expected to perform certain procedures, then he should be given the opportunity to practice those procedures. The contents covered in a small group session or self-study should not be repeated in didactic lectures. Prepare a timetable that provides all the relevant information comprehensively. Theme of the week, sequence of topic, teaching learning methods and duration for each session. The four corners of the box should be used to impart information about the type of teaching or learning session, such as the small group discussion or the lecture, the discipline responsible, such as the anatomy or the physiology, the name of the lecturer giving that session, and the venue where the session will take place. As this is one of the example, here in the top there is muscular system. So this is the timetable for this module only. That have the total weeks for this module is 14 weeks. This is in the first semester. That is the first week module. This is the name of the module coordinator. So this is that timetable. These are the timings from that to that, and these are the days. On the other hand, these are the different uh, topics which we to be covered. As this is that subject. This is anatomy or physiology, pathology, medicine, pharmacology, and these are then the way, the methods which have to be used for that teaching that outcome, that topic. Similarly, it have different. These are the different venues where the topic have to be taught. So this is a smart timetable which should be used to teach all these topics. Appropriate time needs to be allocated for each teaching learning session. A didactic lecture should not be given more than 1 hour, including generous time for the question answer session. The student-centered teaching learning session should be given generous time so that students have enough time to thoroughly go through the topic. We recommend that 20 to 30% of the scheduled time be given to self-study so that students have enough time for literature search and study their learning needs arising from the PBL tutorials. The third last tip, which is the select assessment method. What is assessed and which methods are used will play a significant part in what is learned and how it is learned. The success of integrated curriculum depends on the implementation of the integrated assessment. Having mismatch between the teaching learning strategies and assessment methodologies and an effective recipe for the failure of the implementation of any curriculum. Plan the assessment at the same time while preparing the integrated modules. The assessment tools must adequately test the achievement of desired outcomes. Use assessment tools that assess the higher level of cognition, such as understanding, comprehension, interpretation, analysis, and decision making skills, rather than simple recall of the knowledge. Integrate assessment to reflect integrated curriculum. The examination questions should be constructed by a group of lectures representing different contributing disciplines. The second last step for that development of the integrated curriculum is to communicate with students and staff. So well-informed staff members and students ensure the successful implementation of that curriculum. Each integrated module or any change to it should be presented to the curriculum committee and the faculty meeting for the members to give their comments and approval before being sent to the Senate for final endorsement. At the beginning of each module, give briefing to the students about the structure and learning outcome of the module. Also distributes study guidebooks containing all the relevant information and expectation. So we have discussed in detail about the study guidebooks in the previous session, what study guide is and what make up the study guide and why you use the study guide books. This information helps students to identify their rules and what is expected of them during the module and in the examination. Information can also be disseminated through other means such as website or the newsletters. Regular communication between faculty and students are useful to allay fears and to stop inaccurate rumors circulating. The last tip, which is useful in the development of the integrated curriculum, is to commit the re-evaluation and revision process for the already established integrated curriculum. So, willingness to accept the shortcomings in the curriculum or its implementation and to make the appropriate changes should be an ongoing and continuous process. Draw, draw a plan for the re-evaluation of the curriculum and design a mechanism to institute changes if required. The re-evaluation may be based on the student and staff feedback at regular interval, external examiner comments, and as well as the student performance in the assessment exercise. It is crucial to have a proper mechanism or standard operative procedures of making any change in the curriculum. The change must be approved by the curriculum committee before implementation. The change and its basis should be recorded for the future references. So, if we conclude all these discussion, all these 12 tips, we can say that although the move towards adopting integrated curriculums is gathering momentum worldwide, there are several medical schools that are still unaware of this movement or finding it hard to make the change. Interpretation of integration varies in different institutions and among individuals. Our knowledge about the different level of integration and steps for developing an integrated curriculum will make it easier to make the change. The process of change will be relatively difficult in institutions with established curricula mainly because it needs to change the mindset of the faculty. They are already used to one approach since years and years, and then suddenly you have to change their mindset. You have to shift their mindset to the new approach. Obviously, there will be a lot of challenges, a lot of obstacles during their shifting from the old to the new approach. So that's why when there is shifting from the traditional to the integrated curriculum, it should be start from the few several modules in the start, and gradually the whole curriculum would be then shifted to the new integrated curriculum approach. The training of faculty through discussion and workshop should be an initial step in this situation. These 12 tips which we discuss in this lecture that describe the techniques that teaching institution can use to change their existing curriculum or develop a new curriculum. It is hoped that these tips will facilitate more and more institutions to opt for this positive change in approach to teaching and learning. That was all about the various tips, the 12 tips, which we can use for the development of the new integrated curriculum or the shifting of the previous traditional curriculum into the integrated curriculum. Thank you so much to all of you.